Radiation sickness and vitamin C, and treatment for patients with HPV vaccine and to preventive cervical cancer side effects. Before the lecture, there are a few things I would like to cover. As you all know, on March 11, 2011, there was a terrible earthquake and tsunami in Japan. Starting with you here, warm thoughts and prayers were sent to Japan from people of Philippines. For this, I thank you from the bottom of my heart, and now restore our country's beauty. And next year, in April 2018, at the International Conference on Smoke Medicine, I invite you to show Japan's revival. Our unfortunate consequence of these events has been environmental disaster after the Fukushima nuclear power plant accident in the next day of the earthquake and tsunami in March 12, 2011. So this accident caused by release of radiation, and this was deeply troubled people around the world. We have to consider about radiation exposure from air, water, and contaminated food chain. Radiation exposure affects our health and cause many diseases, including cancer, heart disease, birth defect, etc. So let's think about the mechanism of the radiation-induced cellular injuries. There are two routes of the radiation injury, direct route and indirect route. Radiation can strike the DNA molecule directly and damage it. This is a direct route, and most people believe that this direct route is the only one cause of radiation damage on DNA. I said no. This direct route causes only 20% of radiation injury. Listen, this is only 20%. And so why is it 80%? Other 80% radiation injury is caused by the indirect route. Radiation hits an ionized water molecule and producing free radicals, then react and damage DNA molecules. This is a key point and very, very important part. Indirect radiation injury via free radical is the main cause of DNA damage, and this is 80%. Those mechanisms are widely known and are well written even in the textbook of medical radiology and medical physician as a common knowledge. So now you can imagine that while radiation introduces free radicals and can be neutralized by antioxidative nutrition, including vitamin C. There are many scientific studies demonstrating protective effects of vitamin C and other antioxidant nutrition upon radiation injuries. In 2010, just 1 year before the Fukushima nuclear power plant accident, one article was published by National Defense Medical College and Ground Self-Defense Force in Japan. Article title is Pretreatment with Ascorbic Acid Prevents Lethal Gastrointestinal Syndrome in Mice Receiving a Massive Amount of Radiation. Vitamin C, 150 million per kilogram per day, was orally administered for 3 days to the mice, and then the mice underwent 14 gray radiations. This is very lethal dose of the radiation. Pretreatment with ascorbic acid markedly improved radiation-induced gastrointestinal damage and thereby rescuing mouse. And this is a survival curve, and this mouse was pretreated with a pretreatment with ascorbic acid. Authors of these articles, National Defense Medical College and Ground Self-Defense Force in Japan, commented in this article, when we undertake the rescue of victims from a radiation-contaminated area just after a radiation accident or terrorism, it is important for rescue team members to promptly take vitamin C orally. So, rescue team went to Fukushima nuclear power plant contaminated area in 2011. So did the rescue team took vitamin C at the Fukushima in March 12, 2011? Answer was yes. All of the rescue team took vitamin C, then went to the Fukushima nuclear power plant contaminated area. But this news was not released, distributed to the public. In March 29, 2011, we Japanese College IV Therapy issued an official statement about environmental, radioactive, and health issue. And this statement was issued by working group of doctors of the orthomolecular medicine, and this is Dr. Thomas Levy too, and other famous doctors, and me. And statement is, it is our strongest recommendation that those living in the affected areas regularly take antioxidant supplements such as vitamin C to counteract the negative consequence of long-time low-dose radiation exposure, as well as to protect the health of coming generations. This is members of the working group. And our recommendation is people who have a possible internal and or external radiation exposure should take antioxidative supplements to maintain optimal and oxidable reserve on their own body. Vitamin C, 1 to 3 grams, 3 to 4 times a day. Alpha-lipoic acid, 100 to 300 milligrams twice a day, and selenium and vitamin E, and also with other essential vitamins and minerals. Why we JCIT issued this statement? Because we'd like to save the Fukushima workers. They are nameless, faceless heroes. However, Japanese government, Tokyo Electric Power Company, TEPCO, and news media ignored our proposal. We distribute our statement to all news medias and also distribute the government and Tokyo Electric Company, but also many journals and magazine newspapers. But no answer. In 2011, in April, we have International Society, as a conference of the International Society for Oscar Medicine in Toronto. I presented our proposals in the conference, and all of the attendees accept our proposal and statement. And board committee of the association have a meeting immediately after my presentations, and they wrote a letter, official letter to the government with the signature of all attendants. However, government ignored this statement. So we have to think about the Fukushima workers. And we conducted research of the effect of the vitamin C on Fukushima nuclear power plant workers. And study subject was 12 men who worked 5 to 6 weeks at radiation contaminated area at Fukushima nuclear power plant after March 12th. The work operations at contaminated areas, collecting contaminated water, measuring the radiation level in the plant area, removal of debris, and operation of heavy machineries. We measured plasma-free DNA and also the expression of the DNA damage, DNA expression for cancer-related genes. And two workers were abnormal, higher levels of plasma-free DNA, and 3 were higher risk of cancer score. So we treated these 5 workers using intravenous vitamin C 25 grams every 2 weeks, and also daily oral supplements or liposomal vitamin C, lipoic acid, selenium, vitamin C, and other multivitamins and minerals. And the result was good. Free DNA recovered to return to normal within 2 months. Also, 3 of the cancer workers with cancer risk score, 2 of them returned to normal levels, and this worker does not. But during this period, he went to Fukushima nuclear power plant again and worked in 2 weeks. And next 2 months, 4 months, this worker returned to normal level of cancer risk scores. So vitamin C works. In conclusions, working at the Fukushima contaminated area has a risk of radiation-induced cancer. Those cancer risks can be neutralized by antioxidative nutrition. we strongly recommend that people living in the radiation-contaminated area should take vitamin C immediately. Vitamin C can save the people's life from radiation. This is the JCIT working group conclusions. However, government, TEPCO, and media still ignored our proposals. Fukushima workers have not taken vitamin C. This article, the thyroid cancer detection by ultrasound among residents aged 18 years and younger in Fukushima, Japan, from 2011 to 2014. In the Journal of Epidemiology, this is very famous journals, from Okayama University. The researcher said, among those aged 18 years old and younger in 2011 in Fukushima Prefecture, approximately 30-fold increase excess in external comparisons and variability in internal comparison on thyroid cancer detection were observed in Fukushima Prefecture within as few as 4 years after Fukushima plant accident. So now, the incidence of thyroid cancer in the young people increased in Fukushima area. However, government does not comment it as in this article. Radiation-related health problems such as cancer, heart diseases, and birth defects, etc., will increase in next 5 to 20 years or more in Japan. The incidence of thyroid cancer is increased among young people who have lived in Fukushima area. We believe that daily intake of vitamin C 3 to 6 grams can prevent radiation-induced health problems and keep optimum health. According to the experience of Fukushima nuclear power plant accident, we human beings cannot control nuclear power. Once nuclear power plant accident occurs, radiation harms people's health and makes us more sick for thousands of years. And this may happen everywhere in the world. I heard that the Philippine government will restart of the nuclear power plant of 40 years old age. I'm not sure what happened on the next government decided, but I think nuclear power plant is very, very risky. Japan has more than 50 nuclear power plants, and now only 4 plants start to supply electricity. However, government and TEPCO restart more nuclear power plants politically. And they say nuclear power plant is safe and cheap, and our government now plan to export the nuclear power plant and to the other Asian countries. I think this is crazy. I think nuclear power plant is dangerous and expensive. My opinion as a physician who protects people's health, we should stop all nuclear power plant on this beautiful planet Earth. Now, move to the next topics. Treatment for patients with HPV vaccine side effects. In Japan, we have lots of troubles of radiations and also the vaccine. The immunization of adolescent girls with the human papillomavirus HPV vaccine was initiated to prevent uterine and cervical cancer. The first HPV vaccine, Gardasil, was approved in 2006, and the second vaccine, Cervarix, was introduced in 2009. By the end of 2011, approximately 130 million doses of Gardasil and 44 million doses of Cervarix has been distributed worldwide. In 2010, both vaccines were widely introduced to Japanese girls. In April 2013, Japan government decided to add both HPV vaccine to the governmental recommended vaccination schedule. The new law was to take effect April 1st. In June 2013, only 2 months after the law was issued, Japanese government suspended the recommendation. A new study reported that the adverse events of Gardasil and Cervarix were 1.7 to 3.6 times higher than other vaccines. In 2013, the government task force analyzed reports on HPV vaccine injury, examined 2,500 cases, and found 25% cases to be serious. However, another health experts re-evaluated those cases, evaluated 44% cases as serious. However, Japanese expert committee recommended that. They said adverse reactions are psychosomatic reactions. This is a comment from the government task force. And I show you the movie of the girl when I first treated. Is it psychosomatic? I think no, because the members of the government task force have never seen the patients. So there are many symptoms of HPV vaccines adverse effect: headache, general malaise, muscle weakness, nausea, difficulty of awakening, learning disturbances, muscle pain, dizziness, photophobia, arm and foot finger tremor, joint pain, abdominal pain, irregular menstruations, gait disturbance, and hypersomnia. It said some girl shows memory loss. However, these symptoms was occurred not immediately after the vaccine. Use the average of 9 months. Onset of initial symptoms occurred in average 9 months. So most of the girls and parents and mother could not realize that their symptom was induced by HPV vaccine. HPV vaccine contains an amorphous aluminum hydroxyphosphate sulfate as a powerful adjuvant, and current research strongly implicates aluminum adjuvants in various inflammatory, neurological, and autoimmune disorders in both humans and animals. So once HPV vaccine injected to the muscle, monocyte coming to some site of the injection and catch the aluminum to carry it everywhere. And the brain will come, yes, with day 90, 3 months. So this is a reason why the symptoms, onset of symptom is very late. Some patients for 3 months, sometimes 9 months, and I know one patient, the onset was occurred in 1 year after the vaccine. This is a recent research from the Nagano University of Medicine. And this is influenza vaccine and hepatitis B vaccine and HPV vaccine. And autoimmune vaccine antibody was deposited into the hippocampus, only seen in HPV vaccine-treated rats. But however, the government task force does not say nothing. I communicate with worldwide doctors who treated HPV vaccine in Denmark, Iceland, UK, and the United States. And finally, I started to treat HPV vaccine girls, 20 girls. And I started VCG cocktail, distilled water, 250 ml, with the vitamin C start at 12.5 grams and increase. Some girls need 25 grams to 37.5 grams. And also mixed with glutathione, 800 to 1,200 ml, with magnesium sulfate and calcium gluconate, and with other vitamin B complex, B1, 2, 3, 5, 6, and B12. So you watch the movie of the girl with convulsions. This girl has this is a brain scanning imaging, a perfusion imaging, and this is a defect of the perfusions. So this is evidence of these girls' symptom was not induced by a psychosomatic. This is organic diseases. And I started IVC and glutathione therapies, and 2 months later, she started as in May, and perfusion was gradually, moderately improved. And this is another case. When she visited my clinic, the finger tremor was shown, and she cannot walk because she is a wheelchair. And I administered vitamin C and glutathione. The right movie is immediately after the injections. So finger tremor no more exist. Usually I treated patients a once a week program. I use oral supplements with a discussion with Dr. Klaus Hanke in Denmark, physicians. He is president of the Denmark Association of Osmotic Medicine. We use multimineral vitamins, EPA, DHA, omega-3s. and vitamin D, and magnesium citrate, and other vitamin C2, and probiotics, turmeric. Turmeric means for suppress the inflammation, and lipoic acid, and B complex, and CoQ10, and vitamin B1, thiamine. Some patients, from the Dr. Atsuo Yanagisawa says, some patients has a thiamine B1 deficiencies. Also, we add some E 400 milligrams. Also, some MTHF too. So regarding HPV vaccine adverse effects, symptoms and the timing of the appearance vary by each patient. Some patients for 1 to 2 months, some patients for after 1 year. So these symptoms are different from anything that we have experienced before. This is a new disease syndrome, new syndrome. Unfortunately, the government and the medical societies have not faced this problem proactively. Effectiveness of small molecule treatments is variable. Some are very, very effective and some are not. In order to establish an effective protocol, medical scientists and clinicians have to work together. The onset of HPV vaccine adverse effects comes several months or even more than 1 year after the injection. This delay makes it very difficult to link the symptoms with HPV vaccine. In Japan, more than 1,200 girls were registered as severe, and still new patients were registered every day. We estimate more than 300,000 unrecognized girls with mild to moderate HPV adverse effects. So this is only for severe. So severe side adverse effects means there are 10 times or 20 times more girls with mild to moderate symptoms. The symptoms are commonly seen in young school girls as fatigue, muscle pain, headache, learning disturbance, difficulty in awakening, hypersomnia, irregular menstruations. Those symptoms are very popular in young girls. Japanese medical associations of obstetrics and gynecology, also Japanese Medical Association of Pediatrics, now push to the government to restart the HPV vaccine into the regular schedule of the vaccine schedules. However, this is a very interesting papers. This paper comes from the National Osaka University and Department of Gynecology and Obstetrics. The researcher sends to the questionnaire to all doctors working in the hospitals and related and satellite hospitals. And the question is, do you have a daughter? And if you have a daughter and your daughter is exact age of the vaccine of HPV, do you inject your daughters? That is the questions. In 2013, government stops recommendation of the regular vaccine schedules. Before the 2012, this is the age of the girls and the grade. Doctors of gynecology and obstetrics injected their daughters, injected HPV vaccine to their daughters before 2013. But after 2013, doctors never inject to the HPV vaccine to their own daughters. But, doctor of the gynecologist and obstetrics, they know about the risk of the severity of the cervical cancer, and they know the importance of the HPV vaccine. Also, they know about the adverse effect of the vaccine. So, medical association recommended to the public to take the HPV vaccine. However, the member doctors never inject the vaccine to their daughters. So this is a real world. So in my personal opinion, as an orthomolecular physician who protects people's health, we should temporarily discontinue the HPV vaccine. Medical association should to announce to their members to inject their daughters HPV vaccines. And if the ratio of the vaccine injection in their daughter is more than 50 or 60%, maybe public will agree. But now the injection and the ratio of the injection is less than 2% in Japan now. So thank you very much, and I would like to see you in next year 47th Annual International Conference, Orthomolecular Medicine Today Conference, April 2007 to 27 to 29, 2018 in Tokyo. Thank you very much.